So I thought it'd be really nice to have an update with members before those of us who are lucky enough to be having a break head off for Easter. It's a really busy time just now with all the consultation, particularly in England, around the bill, but also with the elections in the devolved countries. And I think it's true to say at the moment, we really don't know what's going to happen out there in the world of the NHS. But just to concentrate on the latest in England, members will be aware that we're now embarking on a listening exercise. And the RCM will be feeding in to a request from the Secretary of State for a further response to questions around the bill. Members can also respond to the questions in the listening exercise themselves, and you can do this by going into the Department of Health website and downloading some online forms. The questions are very focused, and I think one of the things that it's important for members to remember is that this isn't really an opportunity to tell the government what we feel about resources in the health service. The fact that we're dealing with cuts to services is a kind of separate issue. The government wants to know about things like competition, collaboration, patient involvement, how we'll get professional advice into the new processes in the NHS, how we'll ensure choice for women. So it's important to concentrate on the topics that they're now thinking about again. As I say, the RCM's responding to this further consultation about the bill, but that's not all we're doing. We've got an appointment set up for after Easter with the Prime Minister's health advisor. We've already spoken to Andrew Lansley's special advisor, and we've got some meetings set up with some very senior people in the commissioning team, as well as we've written to David Nicholson, who heads up the NHS Commissioning Board. Our main focus now is not to get rid of GP commissioning, because we've actually been advised very strongly that we're very unlikely to achieve that, but to make GP commissioning work really well for women and their families. And we're doing a big bit of work at the moment which we'll send into the commissioning board, suggesting some of the standards that should be built around GP commissioning to really ensure high quality maternity services. So tons of work going on, but do work hard yourselves out there in your own areas and respond as appropriate. And do, as usual, let the RCM know if there's anything you think we should be doing for you. Happy Easter. Bye-bye just now.